These are medication errors I've seen in the pharmacy, part 2. These are specifically ones that we caught before they made it to the patient. My last video was ones that actually made it to the patient. One error that I've seen is like a Keppra and a gabapentin switch. So a bottle of Keppra was labeled gabapentin and a bottle of gabapentin was labeled Keppra. So seizure medication, Keppra, and then gabapentin's usually used for like neuropathy or nerve pain. Another medication error I've seen is losartan labeled as a torvastatin. Losartan is a blood pressure medication. Torvastatin is for cholesterol. They are both daily though. Another medication error that we caught was Suboxone 8.2 is generic, the buprenorphine naloxone. It was labeled as bupropion 300. So one is an opioid, a controlled substance schedule 3 for opioid use disorder, sometimes used for pain, labeled as bupropion, which is an NDRI or a norepinephrine dopamine reuptake inhibitor, and it also blocks cholinergic receptors. It's used usually for depression, sometimes for smoking cessation. Off label for ADHD, it's a weak stimulant. Another medication error that I've caught, this one was potassium 20 MEQs, extended release, were inside a bottle labeled 10, so it's double the dose. You gotta be careful with your potassium doses. Potassium is used for supplementation when your potassium levels are low or hypokalemia. We usually see this with patients on diuretics like Lasix. Another med error that I guess like we didn't really catch for a while, but we used to have controlled substances in our robot. This is Big Bertha. She will go and she'll scan the cell and she'll fill these pills and they have the patient label on them. So what we did was we had Ambien in the robot and I guess it was miscalibrated. So it was giving people like 10 extra Ambiens like per fill. Jackpot, because like the pill size was like not like adjusted properly. So we took the controlled substances out of the robot because of that.